According to that data, we lost more than 300 people ages 10 to 18 in suicide in Kentucky between 2013 and 2022. Another graph shows the deaths rose significantly here in 2014, and they're not letting up. I talked with one mom and teacher whose son died by suicide. She tells me what needs to be done in schools to keep other kids safe. It's part of our continuing series, Crisis in the Classroom.
His whole childhood, really, until he had about middle school, was, I'm not going to say perfect, but he was happy. He had a ton of friends. He was the child that we didn't worry about.
It's been 5 years since Debbie Zagara's son, Ethan, died by suicide.
Well, he did die by firearm when he was 16. He actually obtained the gun. It was a loaded gun in an unlocked car.
New data from the Kentucky Department for Public Health says firearms were used in nearly 54% of suicides among kids ages 10 to 18, making it the top method for that age group. Kentucky's suicide prevention coordinator, Beck Whipple, recently presented this data to Kentucky school counselors, prompting conversation about potential points of intervention.
We know it's difficult to have conversations about what may or may not be in your home as related to firearms, but we know that folks who die by suicide primarily die by firearms.
He says they're also seeing a significant increase in suicide deaths by Black children and teens. In 2020, of all suicides among Kentucky's Black population, almost 50% of them were children or teens.
We've got to put more protective factors, especially around our Black youth, in doing a lot more education.
Debbie Zagara has turned her tragedy into something positive. She leads suicide prevention training through her nonprofit Ethan's Purpose. But as a high school teacher, she's still witnessing a mental health crisis firsthand. Do you see a difference in the mental health of students now compared to previous years?
I think it's dramatically different than it was, 5 years ago.
If you could change anything about the way that suicide prevention and mental health is handled in schools in Kentucky, what would you change?
I would add counselors and psychologists in the schools just to deal, their sole purpose would be to deal with the kids and their mental health issues.
In that discussion with Kentucky's suicide prevention coordinator, he said the stigma around saying the word suicide has to end. He says you have to be direct when talking with students about it. Now you can watch that full presentation right now on local12.com. Just click this story on our homepage. Adam.
Very interesting, Chelsea. Thank you. If you or someone you know is considering suicide, you can call the Suicide Prevention Lifeline at 988. It's available 24 hours a day, 7 days a week. Local 12's Liz Bonus has been following this mental health crisis closely, from tips to parents to how early intervention reduces crisis intervention. You can find those stories right now at local12.com under health. Just click the Your Mental Health tab. And we are committed to helping schools identify problems and find solutions. If there's an issue in your district, bring it to Local 12's Chelsea Sick. Just leave a tip at 513-223-3029. Email Local12 Classroom Tips at Gmail, or you can use Chelsea's Facebook page.
You can always find our Local 12 stories right here on YouTube. Don't forget to tap subscribe, and then you can get all the notifications.